My name is Gabe Kale. I'm a senior here at Malone University, enrolled in the course Psych 447, Death, Dying, and Bereavement under the advising of Dr. Lauren Seifert, and today I will be presenting on psychological care at end of life. So what kind of led me to this is obviously being a psych major, I'm invested in psychology, but I wanted to go even deeper and look into the concepts of suffering and dignity, especially as a Christian and what that's like at end of life. So being a Christian, feel called to ministry. I feel called being involved in the worship teams I'm in and the college age ministries and young adult ministries that I'm in, um, to kind of continue in those roles. But I have felt a divine calling in counseling that is atypical and abnormal to what I guess what society puts it as, especially in the justice system and like the police system. Um, I've just felt this calling to kind of be a light to the world, to walk with people in their most vulnerable times, but also their most holy times. And so this study kind of helps me understand what it's like to go on that journey and to be with them spiritually, emotionally, relationally, even to a limit physically. And so in this study, um, it was just kind of found that terminally ill patients are prone to having depression, anxiety, and delirium, which in our society, which at the time this was in 2001 that they discovered this, but it was just underdiagnosed and untreated. I've even got to hear examples from family members, family friends, of, you reach a certain age and they're like, oh, it's just old age, there's nothing we can do about it. Um, but, there was kind of a study that was done here during the pandemic that discusses how psychotherapeutic methods even of dignity therapy, like, are meant to preserve meaning and identity. And there was a follow-up study 2 years ago in 2024 that shows that dignity therapy has been effective in reducing psychological distress in both patients and the caregivers. And so during the pandemic in 2020, there was also a study that was done, and it just discussed the physical, psychological, social, and spiritual dimensions of end of life care, which reiterates the importance of holistic and holistic care. And while they might be spelled very similarly, one, the idea of one being one with God, and just the idea of caring for others as He has cared for us and loving others as He has loved us is just a giant principle. And that's something that I want to exhibit in my life, even. And so, kind of 4 points here of psychological and spiritual care for individuals receiving hospice or hospice care. So, it's kind of to understand common mental health concerns at end of life, to evaluate effective psychotherapeutic interventions like dignity therapy, to explore integration of faith and psychological care, and to identify best practices for holistic support. So these are kind of my major points of what I hoped to get out of this project, and which I feel like I've accomplished. And so in this, psychological distress at end of life is common, as that study in 2001 found, and these symptoms were very much so worse than most physical symptoms. I think of the idea of somebody with cancer and the doctor tells them you have 3 years to live, but then they end up living for about 7, 8 more years, but they live every day with the worry of, am I going to die? Am I going to leave behind my kids and I'm not going to have enough support in their lives at this point? Or have I done enough to be able to pass away freely without regret of that I'm letting my family down, or X, Y, and Z? And so there was a study done in 2023 that shows that mental health care is frequently under-integrated into hospice settings, and that early assessment improves the quality of life. And so, like, some of these kind of interventions are, dignity therapy that I said, but it just promotes that legacy building idea and gives people a sense of meaning and a sense of purpose even at end of life. And some randomized controlled studies showed that reduced distress or that dignity therapy reduced distress and improved well-being. And this kind of therapy focuses on like personal narratives, kind of reflecting on your life as a whole, preserving like the sense of identity in the person that is feeling like they are almost a nobody, and strengthening the family connection, because there's nothing that people want more, I feel, than to be surrounded by their family when they are coming to their end of life. And so some of the holistic and spiritual dimensions are that end of life care must address not only physical, psychological, and social needs, but also spiritual needs, because religion influences how physicians approach death and dying. I think, if I was a doctor and I had a patient, a client, and they were bedridden, mere hours away from passing away, I wouldn't want to go in that room if they were a Christian and just be a heartless agnostic, I guess, would be a way to put it, of I wouldn't want to deny them the peace that they rightfully deserve. And on the polar opposite, at the same time, I wouldn't also walk into a room as a Christian if there was a non-believer and try to conform them, but I would try to give them just a sense of peace, whatever their kind of spiritual belief is, because those beliefs shape how the patient copes. And again, it's just like, their sense of identity is built within that. And so psychological care is most effective when integrated with spiritual care. And kind of on the other side of that are some ethical considerations of, you have to be appropriate, obviously. There is a giant variation in pediatric genetic conditions that this study in 2023 kind of showed, and it kind of opened my eyes to, I'm not unconscious to the idea to think that there are 1,000,001 different DNA sets. 1,000,001 is a severe understatement, but to think, we're all uniquely created in the image of God, divinely and perfectly. So while we might have the same causes of death or the same birthdays, we're not 100% genetically the same as anyone else on this earth. And I think, like, even in twins, I think I read an article and it was like, even identical twins vary. But I just think of like this idea of we can't treat everybody the same. And so with that, we have to be ethical in our decision making, and we have to be compassionate and use collaboration in interdisciplinary and ideas. And at the same time, we also have to be family centered. We can't do like, what some doctors do nowadays of, well, I learned this in med school, it's the only solution, blah, blah, blah. Of if the family says something, we have to honor the family too. And we have to create an environment where if a patient is going to pass away while under our care, we have to kind of give them just that sense of peace. And so, with all this being said, this kind of ties into my personal and professional calling, because, as I mentioned before, I want to kind of work up the ranks in both ministry and hopefully into the FBI. And I'm going to probably work with a lot of people who have terminal illness or have the grief of losing somebody, whether it's a victim or a family member or whatever it may be. And I just believe that counseling at the end of life is a reflection of Christ-centered care because it deals with suffering through presence and dignity. You're kind of just being there with them. I think of some of the times that have been hardest for me, and I just think of the people that sat with me. They didn't know what to say, they didn't know what to do, but they were just there. It's kind of my lifeline of if I'm ever having a rough day, I'll text a friend, and they're like, well, what do you need? I'm like, just be. Whether that means just be yourself, just be in silence with me, just be. And so, in that, studies have shown that integrated care leads to better patient and family adjustment. And it's kind of the issue. This is the issue, I would say, that prepares me to minister to people not only professionally, but also pastorally, recognizing the holy aspect of death and dying, which I've never truly kind of considered. And so, in relation to the topic, I kind of want to just touch on the faith integration of, Psalm 34:18, 2 Corinthians 1:3-4, Romans 8:38-39 that are kind of up on the screen. And I kind of want to just remind everyone that human dignity is rooted in being made in the image of God. Suffering is not meaningless, but it can be accompanied by hope. And psychological care becomes an act of Christ-like presence. And kind of the main point in all of that is faith does not replace clinical treatment, but it enhances compassion, hope, and meaning making. And so as I begin to wrap up here, I kind of want to just focus on the importance of psychological care during the end of life stage not being overstated in terms of dignity and relieving suffering for families. I kind of want to just bask in the fact that evidence-based practices like dignity therapy have been proven to greatly enhance emotional well-being for both patient, for all, I should say, patient, family, friends, even those that are clinicians or doctors. And the inclusion of these components of psychology and spirituality ensure that care is holistic in nature. And so as counselors and people of faith, I believe we are challenged to walk with others in compassion, with competence, and to have hope during our final chapters in life. And so this is the conclusion of my presentation, and I will be now sharing my references, and I just want to say thank you for your participation, of being interactive by paying attention, and even if you only watched this on 2x speed or whatever it may be, I just hope that you were able to take something away that can sit with you today, and that God just blesses each and every one of you in a newfound way today, and that you, whether you be struggling with grief, whether you be struggling with illness, whether you be struggling or suffering with any topic that we talked about in this semester or even in this presentation, I just pray that God's peace washes over you, and that you are able to just bask in the hope of heaven.